And we are going to start with my favorite thing. I'm being sarcastic, but no, we are definitely going to start with our icebreaker. So, what is one thing, big or small, that you're looking forward to this in this new year or this year? And for those who joined right at the top of the hour, I already kind of said what I'm looking forward to, and that is no more snow, no more of this not being able to park. I actually live in the District of Columbia. I live in DC, and this is not being able to find parking in front of your house for 30 minutes is not my idea of starting the year off right. So that is what I'm looking forward to. No more of snow. I don't know if it's going to happen, but that is what I'm looking forward to. So everyone, please feel free to add it in the chat, or if anybody wants to come off mute and just kind of say it out loud. Love to have it. I don't know, Shanae, how long we have. I know we don't have too much long to have people. Like, I think I don't know if we want to go ahead and get started with the agenda, but looking forward to spring. I see that. Absolutely. I'm gonna let you read it since I am driving.
Okay, yeah, please, please, please. I got you, Jessica.
You got me. All right, thank you.
Yeah, no problem. Please drive safely. Joyce
Thank
is
you.
looking forward to the spring. Catherine is in the same boat, looking forward to spring. Leslie looking forward to traveling in 2026. I love that. Are you going anywhere special, Leslie? And anyone else care to give input on the icebreaker? Ooh, Turks and Caicos. That's right. I love that. Love that for you. Margaret Fowler, looking forward to traveling to visit my children. Yes, love that. Lots of traveling. Ryan, vacation in St. Thomas. I see lots of islands. I love this. Everyone's looking for warm weather because we don't have it here. Although it's been a warm week in the 30s. It's been our warm week so far, which is strange to say.
Wait till this weekend.
Oh,
Let me stop.
yeah. I love that. Raya's looking for 10-year wedding anniversary and moving to Prince George's County. I love that. Oh, and the World Cup. Yes, yes. Lots of great things to look forward to. Looking forward to becoming engaged in the work and working with others. I love that, Kelly. I've shared with some other work groups. My daughter turns 10 this year, and I am surprising her. She thinks she's having a birthday party. I'm surprising her with a Disney cruise. So I'm hoping she doesn't expect that and the birthday party. But knowing her, she probably will. She's not going to get it though. But I'm definitely excited. This will be my first cruise, her first cruise, but definitely excited to surprise her. I just have to keep my mouth shut for a couple more months, but it's getting hard. Thank you all for your feedback. I appreciate that. We'll go ahead and move forward, and feel free if you want to continue to share in the chat, you are more than welcome to do so. But now that we've had our welcome and icebreaker, I will briefly walk us through today's agenda. We'll follow the agenda review with an introduction of two coalition staff that are joining us. Then we'll have a short overview of the Community Health Improvement Plan, or the CHIP as we call it. So just kind of talking really quick about what's been done so far, what's coming next. We'll also talk about the renaming of the work groups and some transition there, and then spend the bulk of our time really focusing on chronic disease action planning. And then we'll close with a few community announcements and adjourn for the day. So today is very much about shared learning, collaboration, sharing ideas. So I encourage everyone to participate. If you have questions, you can put those in the chat and definitely share your perspective. All right, so we have two staff. One is returning and another is new, but I wanted to introduce Rhonda Yakub. She is a public health coordinator with over 40 years of experience in health planning, program development and administration, grant writing, community engagement. She does it all. She holds a Master's of Health Services Administration from the University of Michigan School of Public Health, and she currently oversees the Prince George's County Health Department Senior Survey. So if anyone's familiar with that, she is instrumental in pushing that survey out. She also supports things like quality improvement, coalition building, and health planning within the Office of Assessment and Planning. So we welcome Rhonda back to the coalition. And we also have a new staff person with us, Ashton Jordan. We call him AJ. Ashton is a public health professional with a strong background in health communication, equity, and community engagement. AJ holds a BA in communication with a concentration in health communication from Michigan State University. He has an MSPH in health education and health comms from Johns Hopkins University, and he is currently pursuing his DRPH in leadership and management at Claremont Graduate University. So this brother is educated. And he also has extensive experience planning and promoting community-driven health initiatives that advance equity and strengthens partnerships. So we're so happy to have both Rhonda and AJ on board with us. I don't know if Rhonda's with us, but AJ, if you just want to jump in and say a quick word, you're welcome to do so.
Thank you, Shanae. Thank you, everyone, for having me. Looking forward to doing good work.
Awesome. Thank you. That was a short word. I love it. Yep. So you'll see Rhonda and AJ in our work group meetings and some of the co-chair meetings, and you'll hear their names a bit more often because I finally have a team. So I'm excited to work closely with both of them. So I'm really just going to go over the Community Health Improvement Plan very briefly, just to ground today's conversation. Again, we call this the CHIP, and I just want to make sure that we all have this shared understanding. It's been since November since I've seen you all. So we have some new faces with us today. Some people might need a little reminder, and that's okay too. So some of these slides look a little familiar at first. They do, because they are. And I just want to, again, just lay the groundwork for those who may be new or who may have missed some of the information last year, but also to share updates on what's been completed and what's ahead, because a lot has happened. So the CHIP is really just our collective roadmap for improving community health outcomes and advancing equity here in Prince George's County. I like to think that this CHIP is collaborative, it's data informed, it's community driven, and it really helps us focus our collective efforts on the health challenges that really matter most to our residents here in Prince George's County. And it helps to align us as partners around some of the shared long-term strategies, typically over a 3-year period. Now, our CHIP development process is guided by the MAP 2.0 framework, and MAP stands for Mobilizing for Action through Planning and Partnerships. It's a nationally recognized approach that really tries to emphasize things like strategic thinking, things like collaboration, as well as continuous learning. And this framework guides us through 3 important phases: building the Community Health Improvement Foundation, telling the story, and continuously improving the community. But I really like this framework because it helps us prioritize the issues that exist. It helps us identify resources in our communities and to take a more coordinated action that reflects what truly matters to the community based on the data that we have, the lived experience of our residents and partners, as well as the local assets and resources that exist in the community as well. Now, this work really began with our community health assessment, or the CHA, which was written to help us understand what exactly is happening in our county. So what are the health outcomes? What are some of the conditions people are living in? And what are some of the factors that influence their health on a daily basis? And so what we do is we use this MAP 2.0 framework to guide us in translating the CHA data into actionable CHIP strategies that can really make a difference in our community. So you'll hear me say time and time again, like the CHA is the community's health story, and the CHIP is how we work together to change the next chapter of that story. So again, I know we're in the new year, and this work group hasn't met since November. So I just want to briefly recap with you all what's already been accomplished so far. And to date, we've completed phase 1, where we focused on building our foundation. So everything from strengthening partnerships, aligning shared values, establishing a vision for the CHIP, ensuring that structures are in place for collaboration. And last June, our data and assessment team, they published this community health assessment. And within it, there were 5 priority health areas that were identified. And if you look on the screen, those priority health areas include behavioral health, maternal and infant health, chronic disease, access to care, and the social determinants of health. Now, we shared these findings with you all as coalition members and partners, as well as with the broader community. So if anyone wants to take a look at the CHA document, I'm happy to share that with you via email. But in September, we also established a CHIP steering committee to review the data, to review the proposed CHIP plan. We discussed realigning the coalition work groups, and we voted on problem statements for each of these 5 priority health areas. In November, we transitioned into phase 2, and this phase helped us focus on telling the community story behind the data. And if you remember, way back in November, we held our facilitated root cause discussions with each work group, and we used what's known as the 5 whys approach. So our data team came and they shared some of the key findings and health indicators from the CHA. They reviewed the problem statements that were selected by the steering committee, and then we opened the floor for discussion to gather some partner feedback, some community feedback to really start to dig deeper into some of the root causes of the ongoing health challenges by bringing together that data, your professional expertise, and the lived experiences as well. Now, those insights from those conversations were then summarized and captured in what we call fishbone diagrams. And those diagrams helped us to visually map the root causes that we identified together. And those fishbone diagrams were shared at the December quarterly meeting. So a lot was shared at that meeting if you missed it. But you can see that a lot of groundwork has been laid thanks to our staff, our steering committee, and our wonderful partners like you. Everything from data collection to community input to alignment across priority areas. And today we're going to build on that process. And that brings us to phase 3, which is where we are now. And this is where all of the work we've done so far starts to come together and move into action. Our focus now shifts from it shifts to alignment and impact. And so we're making sure that the strategies that we're going to eventually develop actually address the health priorities that we identified. So as mentioned in our last meeting, we're officially transitioning this month into our newly aligned coalition work group. So you may have seen the name change. And I'll share a little bit more about that transition shortly. But the biggest part of this phase is that we're going to begin drafting those action plans, working closely with all of you to refine the goals, objectives, and strategies for each priority health area. And as those plans take shape, we're going to be actively seeking your feedback, your expertise. We might vote on some things. We might have some interactive discussions, working collaboratively to draft and review and finalize this CHIP document. Our goal is to have it finalized and published by July, so that way we can share it with the community, with our partners, county leadership. So we really want to get buy-in and garner support for implementation. So a lot to come, but I'm excited about the work. And to support this next phase, we've restructured and we've renamed our coalition work groups so that they align a bit more closely with those 5 CHA priority areas and then help connect directly to the CHIP strategies. So as part of this realignment, we are being intentional about equity and health literacy, using things like clear, plain language that's easier for our community members to understand, works well across other languages. So you'll see that in the name change. The updated work group names are also consistent in style. So this kind of helps to create a stronger sense of cohesion across the coalition and helps to reinforce a focus on more positive action-oriented outcomes. So having a healthy start, having healthy minds, things like of that nature. And then you'll also notice that health equity is no longer a standalone work group. It's actually now going to be a core lens across all of our work. So to support this, I've asked the former health equity members to join some of the other work groups, and they're going to serve as our subject matter experts to make sure that our goals and our strategies are all shaped with equity in mind. So while the names and the structure of the coalition may look a little different, the expertise, the partnerships with you all, and the commitment that you all bring will always remain central to this work. So again, just a quick snapshot of what's been done, where we're going next. And now that we're grounded in this process, I want to turn our focus specifically to chronic disease. And that was the topic we discussed back in November. So I want to share briefly what came out of the CHA, as well as those November discussions to really help guide the next step in our action plan. If you remember, the problem statement that was presented really highlights that preventive care utilization, it remains low. And unfortunately, it leads to late stage diagnoses. It also leads to greater incidences of hospitalizations. And we got some community input for the CHA, and that really just emphasized that early screenings, sustained maintenance programs, improvements to the built environment, things like affordable healthy food access and safe active living spaces, all of these are key to preventing chronic disease at every level. And so at that November meeting, we used the 5 whys approach to really understand what's driving these trends and to further get to the root causes for why these health problems even exist in our county. And this helped us look beyond symptoms to more systemic issues, things like barriers to accessing culturally responsive care, things like limited care availability overall, fragmented services, all of these things that make it really hard to navigate some of these health systems. And we're going to use these root causes to determine our focus for the action plan today. What I thought was really interesting to note is that many of these themes actually show up across multiple health priorities. So we've heard across work groups that health literacy and cultural responsiveness, they are key factors in a lot of these priority areas. We heard about workforce shortages, gaps in care. We've heard about the lack of accessible and culturally relevant materials. So considering the CHA data, the root causes, some of these shared themes, we now get to start putting the pieces of this puzzle together to really start to develop some of these strategies to address this problem statement. And so that's where we are today. We are action planning. Now, I do want to preface by saying, I recognize there are a lot of ways that we can address each of these priority health areas, but rather than trying to tackle everything at once, I think it's best that we focus our efforts on identifying a strong starting point, something that feels urgent, but yet feasible, something that aligns with the current efforts that are already going on with our coalition partners, things that are already happening in the community. So think quality over quantity. Where can we focus our resources and our time and our staff to really address the problem statements that were presented? So what I'm going to do is I'm going to walk through several potential starting points with you all. And these starting points were, again, informed by the data. They were informed by those November discussions. And what we'll do is we'll open the floor for some discussion, and then we'll end with a vote on which one we think we should prioritize for the chip. And then in the future meetings, we're going to narrow down and streamline some of our approaches so our efforts are a bit more focused. But what we're seeing consistently across the data and within the community conversations is, again, that preventive care utilization is low, and it again leads to later diagnoses and avoidable hospitalizations. So this isn't just about individual choice. I think the root causes point to, again, those access barriers, system designs, trust and communication gaps, environments that don't always make prevention, like eating well or staying active, easy or even realistic for many people. So today really is just to focus on where do we act first. And I think these starting points are going to help us move from those root causes to strategies in a more thoughtful and coordinated way. So I'm going to go ahead and read these starting points to you all for those who are just listening in or can't see the screen. And then I'll open the floor for some discussion. But one of our first starting points is prevention and early detection. So it considers that shift from late stage treatment to routine screenings, wellness visits, and early identification. We then have access to primary and preventive care. So there was some conversation about how can we reduce those barriers related to scheduling appointments, to availability with providers, transportation, location, where do we receive services? So some conversation around that. Our third starting point was trust, cultural responsiveness, and health literacy. So this is focusing on addressing some of the stigma that exists, some of the communication barriers between provider and patient, some mistrust as a result of that, that really can lead to limited preventive care usage. Our fourth starting point is system navigation and care continuity. This is focusing on improving follow-up, referrals to services, and continuity across care. And then the last starting point considers our built environment and healthy living supports. So if you remember in that root cause discussion, there was a lot of conversation about how do we improve access to things like healthy foods, to safe spaces for people to walk and exercise and support, like prevention supportive environments. So these are our 5 starting points. Again, they came out of the data, they came out of these conversations that we had with you all back in November. And so I want to open the floor. I know I kind of gave a lot of information at one time, but I do want to present these starting points to you all and then open the floor and consider the following, right? Like, out of these 5 starting points that are listed, which one do you think is most pressing? You know, where do we think we can have the most impact? What do you think is most feasible? What do you think is not feasible? Because what we want to do is make sure we are focusing our efforts in a realistic way, that we're considering our capacity as a coalition. So I want to open the floor and you can unmute yourselves to speak and type in the chat. And I'll open the floor at this time. You have to excuse my sniffs. I'm coming down with a cold, so I apologize if I sound a little stuffy today.
Hi, apologies for not being on camera. I'm eating my lunch.
Enjoy.
I see the system navigation, care continuity, and then the environment and healthy living supports as kind of touching all of the others as well. And to me, those seem particularly important and a great, those are great categories to focus in on from my perspective.
Okay. Thank you. Taking some notes. Yep, and that's actually something that we saw and discussed in some of the other work groups is while these are separated into 5 starting points, some of these might overlap. We might touch on some other things as well as we, you know, develop our goals, develop our objectives, and some of our strategies. They may address prevention early detection, or they may prevent trust and health literacy, things of that nature. So totally fine. But thank you for that feedback. I see Joyce says access to care, access to primary and preventive care. Thank you, Joyce. And if you'd like to expand a little bit on that, on why you're selecting that, or why you think we should prioritize that.
I think it encompasses a lot of different touch points. For one, there's a shortage of clinicians and physicians, and then of course the residents can't access, with ER visits. It's just not accessible. I think that it's a huge barrier in the county, and I think that it also encompasses other areas like mental health and other chronic diseases. So I think that would be our number one focus.
Thank you, Joyce. And I see there's another thumbs up, so someone agrees with you there. Any other feedback?
This is Margaret Feller. I would just like to say again, they're overlapping, but I think we've talked about this in other groups. It's like system navigation and care continuity. Sometimes people don't know how to access services that are available that could be preventative or early detection, and then really, building that continuity of care through, the things that are already available, prevention, early detection, screenings that are available, and if they need to be escalated, making those warm handoffs and contacts to services. So, care continuity, I think, is going to be the key there too, because then you know where to navigate and prioritize where they're navigated to for their next appropriate, care.
Thank you. Thank you for that feedback. I heard another voice.
Hi, good morning.
Good morning.
Excuse me. I think it's kind of hopeful to see that a lot of these starting points kind of overlap. So if you address one, you're addressing multiple ones. I think I agree with a lot of the comments that others have mentioned. Thinking about prevention and early detection, and I'm not sure what the capacity of the coalition is, but being able to partner with other kind of organizations to help with the screenings, or even as the last person mentioned, in terms of helping people to navigate kind of healthcare systems and to know what screenings I think would be important. Let's
So
see.
thank you for that feedback, Kelly. So it sounds like we're. Go
I'd
ahead.
like to, hi, I'm Leslie Jefferson. I'd like
Leslie.
to focus on, of course, near and dear to my heart are those healthy living supports as well as preventative care. So the two of those together seem like a good place where it could be low hanging fruit for this group, if that is the focus on where the work will come from. So those are my two
Excuse me.
areas.
Thank you.
Oh, hey, it's Jessica. So I'm going to double down also on the access to primary and preventative care. Obviously, that's a huge area that we look at when we're talking about cardiovascular health, and how we can how before we can get to the point where it is a chronic disease, how can we tackle the issue and a prevention and a landscape of prevention. So definitely want to see how we could really focus on that, and what are some preventative areas that we can really look at in the county to really increase people to really access, and I guess maybe it would be access, because I think that there are preventative services and people are maybe not always taking advantage of it. And we feel like if people do take advantage of the preventative services that are available to them, they wouldn't be, we could prevent it before they come into that, that episode where there is maybe a cardiac event, and before we got to get to secondary prevention. But let's start with primary prevention first.
Love it. Love that. Thank you, Jessica.
Mhm.
It sounds like we're looking for some opportunities to intervene before conditions get worse. Sounds like a general consensus across the board. That's good. Screening specifically, some wellness visits. Are there any early touch points that are underused right now, in your opinion, or based on your experience? Things like primary care, community sites, work sites, faith-based settings, things of that nature. Or any other thoughts on some of these starting points?
Hey, Sinead, Kelly in the chat asked if you could repeat the question.
Oh, sure. I'm sorry. Thanks, Kelly. I have two screens going on, so I can't see the chat. But yeah, I was asking, are there any, how did I word it? Are there any touch points that we feel are being underutilized right now. So places like community sites or faith-based settings, churches, any work sites, anything of that nature where we think we could maybe prioritize some of these screenings or wellness opportunities to share the resources out in the community.
Danae, I think this is Margaret Fowler again. I think when we speak about, the faith community, there's sort of like a targeted or group of people that are meeting on a regular basis, and that might be an opportunity to build the trust, cultural responsiveness, and health literacy. To use those venues and because most churches also have health ministry components to them. So, that might be a really good opportunity for the trust, cultural responsiveness, and health literacy. And it could even be the prevention and detection that they could, start helping with some of the screenings. So that would just be where I think the faith community would be, a really good opportunity to maybe integrate those two.
Great. Thank you for that feedback.
I would agree. I think that the faith-based community is a great place to start. They often already have opportunities to provide information and to provide outreach. So communicating would be in those arenas would be great. I find that they're also very receptive to folks that want to come out and provide screenings and information. So a good place to start, and you get a I would say an engaged audience, which is probably important as well.
Awesome. Thanks for that feedback. Yeah, it's always
Hey,
important
it's
to
Jessica.
consider that.
Oh,
Go ahead.
Yeah, I agree. Also, faith, any time where people gather, faith-based organizations or either senior centers, but
Oh,
also kind of looking at how do we kind of develop that sustainability? Because I know with what we try to do when we're working around, hypertension and our blood pressure initiatives, what we
mhm,
like to do is work with those whether it's those leaders within that whatever setting that is. So for example, if it is a faith-based organization, if they have a
mhm,
health and wellness committee, maybe identify like a lead volunteer and we provide them trainings or and everything that they need in order for them to kind of implement a self-measured blood pressure initiative. So they
mhm,
have all the training and resources and we provide them equipment, whether it's blood pressure monitors, educational resources, and then they can also develop um a screening and referral system. So therefore, when they do have opportunities when they're screening either members of the congregation or members of that community, they have a list of neighboring clinics, whether they're federally qualified health centers, that they can actually refer those members to that maybe don't have a primary care to get that prevention. If they do are identified as whether it's borderline hypertension or they're hypertensive, or maybe they're just not being compliant currently with the medication that they already have been prescribed.
mhm,
Because we feel sometimes, a lot of times, like when unless it's systematic and you have like a partner, like a clinical partner that's going to come out to that organization maybe once a month and they kind of make that maybe part of the part of implementation as far as
sure.
systematically. We feel like training whoever and having that as part of their practices in order to train their volunteers or their staff in order for them to provide the services. We feel like that's just more systematic and that's just more sustainability in order. So no matter who leaves, they're always going to have that training, and then we can always
Mhm.
retrain how to take blood pressures and all of that. And it's just blood pressure. And, so just kind of want to put that out there too when we're talking about just screening and referrals and getting individuals to that primary care that they need.
Love that. Thank you for that example as well. It kind of reminds me of the Healthy Hearts Ambassador program. Um, like train the trainer, and they go out and do some of the education and some of the screenings, and then they teach others how to monitor their own blood pressure at home and things of that nature. So that kind of reminds me of that a little bit. Awesome feedback. Anyone else or any other thoughts on some of these other starting points? It's really great feedback so far.
Common things that I find is that the residents lack awareness and maybe having just a network of some of the community, like we were talking about some of the community centers and the senior centers and some of that nature to be a part of the communication line of some of the services that are available for them to have access to care.
Love that. These are all great ideas. Any last minute feedback? Any thoughts on where we should start? All right, well, hearing none, then I think it's okay if we move on to our to go ahead and move on to our vote. Let me see if I can change this screen. All right, and what I'm going to do is I'm going to now open the poll in the chat. You should be able to see it in just a moment. And if you have any issues using it in the chat, you can also just type your response and I'll mark that vote as well. But we have discussed these starting points and we'll go ahead and use this polling option on which starting point we should prioritize for CHIP planning as it pertains to chronic disease specifically. And again, as you vote, I just encourage everyone to think about where focusing our time and our energy and our resources will help lead to the greatest impact over the next 3 years. Because again, this CHIP planning process is 3-year implementation. So which option do you think allows us to be the most focused and effective as we move into action planning? I'll give you a moment to read through and vote. And again, it's not to say that we won't touch on some of the other things, because I think there is some overlap for sure, as many of you stated. Got some votes coming in. I'll give you another 5 seconds. Oh, got a shift here. I'll give you another 5 seconds. I see a couple last minute responders, so I want to make sure everybody has an opportunity to vote. So we've got 12 responses. Okay. All right, so based on the input that's come in and the votes that have come in, 42% of us agree that we should focus on, that we should start with the built environment and healthy living support. So again, how do we strengthen access to things like healthy food, safe physical activity, and prevention supportive environments? Again, it's not to say that we won't be able to touch on some of these other items as it relates to that, especially as we really dig into goal setting and strategy development in the next couple of months. But this will be our starting point based on you all's feedback. And so I will take note of that. AJ, if you don't mind taking note of that as well. And then when we come back at our next meeting, we'll delve even deeper. So thank you all for your votes. Again, we'll use this selected starting point to develop those goals and objectives and strategies and things of that nature at our next meeting. Can everyone see the results? Or is that
Yep.
just me? Okay, perfect. All right. I see some thumbs up. Thank you all. So I do have like a little homework for you all, nothing too labor intensive, but between now and then, I just kind of want you all to think about the starting point, think about some of the other items that were discussed today, and kind of start to begin to brainstorm on, partners we have here with our coalition, who's missing from the table, what programs or resources already exist. Jessica mentioned some things that they do with the American Heart Association. I mentioned the Healthy Hearts Ambassadors Program. So I know there's lots of things that currently exist in the county. So bring those to the table at our next meeting. We can talk about some priority populations where there are gaps in care as it pertains to the starting point. And what we'll do is we'll use that information to begin creating those goals and setting those objectives and really starting to streamline those potential strategies. So if you've noticed in this CHIP process, we've kind of went from this big, broad scale, and we're starting to just really narrow it down for our CHIP plan. So I always look forward to these meetings and continuing to work together with you all. And I thank you all for your engagement and partnerships. Are there any questions before I turn it over to AJ for community announcements? Or any other thoughts or last minute comments? Oh, I see Jessica's comment. If I'm not mistaken, I believe there will be several changes coming to Medicaid and qualified health plans, which will directly impact access to care. Thank you for sharing that link, Jessica. Awesome. All right. Well, hearing nothing else, I'm going to go ahead and turn over our community announcements to AJ, who's going to highlight some things that are coming up in the next couple of months. AJ?
Thank you, Shanae. Oh wait, I think I can take control. Oh, there we go. Perfect. Thank you. Hope Connections and University of Maryland Capital Region, they're going to be hosting a virtual all cancer support group. It's going to be on Wednesdays from 12 to 1 p.m. You can register to attend to connect with others, feel supported, and gain that additional information and resources to support your journey. Next slide, please. Parks and Rec has their winter activities guide available. I think it's available for download as a PDF. So please take a look at that PDF. It's hyperlinked on the slides and they'll be made available after the meeting. So you can join Prince George's County Community Partners each month for 90 minutes of free virtual fun. It's called Dine, Learn, and Move. It's an opportunity to get active and learn tips for making healthy choices. February sessions will focus on ways to take better care of your heart through food and movement, and the class will take place on Wednesday, February 25th from 6 to 7:30. And the email to register is on the slide and also hyperlinked. So please save the date and join MedStar's 2026 Health and Resource Fair at Clinton Baptist Church. It's going to be a day filled with educational resources and support for the Prince George's County community and residents. It's going to be Saturday, March 14th, 2026 from 10 a.m. to 1 p.m. at the Clinton Baptist Church. So if you would like to attend as a vendor, there is a vendor form hyperlinked on this slide. And again, these will be shared after the meeting. The UMD Capital Region is hosting chronic disease self-management classes. So this program is designed to empower individuals living with chronic diseases by providing them with the tools and resources needed to manage their health more effectively. This workshop is convened in person for 2.5 hours each week over the course of 7 weeks, starting Tuesday, March 24th. You can visit their website for more info and to register. And again, I'm going to skip over the hyperlink part. Everyone will have access to the hyperlinks after the meeting. The UMD student survey, a UMD student is asking for more survey completions. This student is examining the relationship between personality and health behaviors. A small incentive is provided for your participation. If you're 18 years or older and a Prince George's County resident, you are eligible to complete the survey. Just a few more, everyone. So the Latino Community Research Opportunity out of University of Maryland. This is an opportunity to participate in a study that seeks to understand how Latino adults in the DMV area are experiencing online videos about immigration issues and how this may affect their well-being. The eligibility survey is very short, takes less than a minute, and is available in both Spanish and English. Those who are eligible will be able to participate in a 45 to 60-minute interview via Zoom or in person, and will also receive a $15 gift card as a thank you. MDPP, or the Medicare Diabetes Prevention Program, is a free program to help residents reduce their risk for type 2 diabetes. If you or someone you know is at risk, please call or text the number on the slide to attend a virtual information session. And these are held every Monday from 5:30 to 6 p.m. via Zoom. Oh, if time, sorry, Taylor or Amber, did you want to comment on the Medicare Diabetes Prevention Program? I don't know if I see Taylor or Amber in the call.
If they're not, that's okay. We can move on.
Okay, heard. And so just a couple of coalition-specific announcements to share as well. So the first is that we will be launching our new work group called Healthy Start, the Healthy Start work group. That'll be launched on February 19th, which will focus on maternal and infant health and ensuring equitable access to quality care that supports healthy pregnancies, healthy births, and a strong start to life. So if you're interested in participating or would like to learn more, please send an email to the PGHAC email address. And then last but not least, we have a QR code and link for a brief survey. So please take a moment to update your contact information for the coalition directory. Some partners have transitioned into other priorities, and we've had some new members join us as well. I believe the last time you all met was in November. So please take that time to fill this out so we can update our information so we can make sure everybody's getting the information that they need. And with that, I'll pause and see if there are any other partner announcements.
Hi, thanks. This is Kate from Suburban Hospital. We have the Women's Health Symposium in partnership with the Art Association on the 18th, and I'll put the link to register. It's for anyone. This year, it's called Breaking the Silence, How Women Can Advocate for Their Heart Health. And it's at the lunch hour virtual.
Thank you, Kate. Were there any other announcements?
Sure, I'll always take the time to announce Giants Healthy Living Team. We are always here to assist and help with your nutrition education and healthy living needs. You can feel free to reach out to me, Leslie Jefferson at giantfood.com, or reach out to healthyliving at giantfood.com if you need any support for the programs that you're having.
Thank you, Leslie. There are no other announcements. I will turn it back over to you, Sinead.
Awesome. Thank you, AJ. And thank you, Kate and Leslie, for those additional announcements. And I see the link in the chat, Kate, so I'll make sure that goes out in the follow-up email. And Leslie, if you have anything, or if anyone else has anything they want to have included in the follow-up email that goes out with the presentation and video, if you could have that sent to me by noon tomorrow so I can include that and have everything sent out. So thank you all so much. And I do, again, just want to highlight, thank you, AJ, for sharing about the survey. We are trying to put together this coalition directory, and there have been a lot of changes prior to me coming on, and we've had a few since I have come on, a lot of new faces, which is really exciting. So please, please, please scan this QR code. I'll make sure the survey link goes out as well so you can update your information. But this is going to be the best way that we can keep tabs on who's with us and what zip codes you all serve, what topic areas you all focus on, and if there's any interest in other work groups as well. So thank you, thank you, thank you for doing that for us. And I did just want to share just a quick snapshot of our upcoming work groups. And this is for the remainder of the quarter. So we welcome you all to participate in the other work groups, especially during this CHIP planning phase, because we are going to need your expertise and your support as we develop this CHIP action plan. You'll also notice that the Healthy Living Work Group, we're going to meet ad hoc next month. Again, I have till July to complete this plan. So if you all don't mind just sacrificing another hour next month so we can stay on target and stay on task with our timeline to meet that July goal, I would really appreciate you all coming to next month's meeting, and I'll make sure a meeting invitation goes out. I do apologize for multiple invitations that may have gone out. Outlook was being very trippy with me this week, so please forgive me if some of you all had received multiple meeting invitations, and I'll try to make sure that doesn't happen again. But you will get a separate ad hoc meeting for the March 4th date. Okay. And as we close, I always just want to thank you all so much for your participation and your insight and your experience and all the things that you bring to this work group.